Kenya is one of the developing countries in the world that has a very, very poor record of investing in mental health. The government has employed less than 70 psychiatrists, and the Ministry of Health is only putting less than 0.1% of the health budget in mental health. And with 47 million people to serve, the resources and the manpower that the government has set aside is not enough. And this is what triggered us as people with lived experience and our friends who are psychotherapists to sit and try to figure out how we were going to come up with something that could fill the treatment gap that has been left by the government's underfunding and under-resourcing this department.
I think it's important to understand how to recognize that a person suffers from a trauma-related mental illness. That's why I try to give some information on the most common diseases following a traumatic event. This is the post-traumatic stress disorder, depression, and also anxiety disorder.
Psychiatrists and psychologists are very few and not in touch with the community, not in touch with the people at the community. So there's a gap of response and there's a gap of support to people with mental health conditions. So if the community itself, the people at the community, the secondary caregivers at the community level, if they are taught, if they are taken through basic counseling skills, if they are taken through mental health conditions, just a brief of understanding what it is all about, then they are in a better position to assist this person who comes to them as the first response before they can refer now to a psychologist or a psychiatrist.
Can help them to come to a realization that really I need.
Extra reading that you can check.
There's a serious neglect in how mental illnesses are addressed. We still do not have enough capacity, and most importantly, we are still doing badly when it comes to funding and donor funding. So I would say even in government, in terms of prioritizing mental health illness as a public health concern is something I would say is wanting gravely.
The World Health Organization is trying to do what is called a task shifting in terms of now bringing on board people who are laymen and maybe they're not professionals, but at least they'll be able to help in terms of bridging the gap in mental health. So I think this is a very important training, because I think once the group is trained, they'll be able now to bridge the gap in mental health in terms of helping people in the community, because we find that a lot of people in the community, they may be going through a mental health condition, but they're not aware of it. But if such a group is trained, then they are able to now go back to the communities and help people in terms of addressing mental health.
We said that we are not helpless. We said that we're not going to wait for solutions from government and international NGO. And we said, as members of the community here in Nakuru, we are going to do something that will have an impact. And that is how PDO was formed. And for the last 3 and almost a half years, we have been working with our community, providing free mental health services and doing advocacy to make sure that those people who are affected have a more conducive environment to thrive and are not discriminated or treated poorly on the basis of their mental health.
When I came here, I took training and met many doctors, speakers. Had a very amazing experience that after this training I can really help somebody who need our help, and we can reduce the rate of suicides.
Wakati nilipata hii training ambayo nilipatiwa na PDO, imekuwa msaada kwangu kwa nyumba, kwa maisha yangu na kwa community at large. Kwa sababu hapo mbeleni sikuwa najua mambo ya mental health ni nini. Nilikuwa tu nafikiria mental health ni wazimu tu mwenye napatana naye kwa barabara. But from wakati nilipata training nilijua mental health inaguza kila area. Hata unaweza kuta mtu ametulia na kumbe ako na hiyo mental illness.
So this opportunity was a chance for me to get to learn how can I be able to diagnose some of these symptoms, how can I be able to be of support so that the intervention that we are seeking or what we want to see, the changes that we want to see in the lives of these girls can be able to be realized.
Yeah, I've learned so much, like the new disorders that have come up, the complicated grief. It's of great help, especially to health workers, social workers, and all those kind of people who are in social sciences.
Anyone who is working directly with the community, my colleagues and our stakeholders, so that they can receive the skills and the information that we are going to learn in this training so that they can help various people in the community.
For me, Irogi Mwenja, this has been an amazing journey of triumph, of inspirational stories, of successes, and even recognition, both locally and internationally, that has inspired many other people to think about mental health more positively, think about taking more action about their own personal health and the health of their family members and their community. And I think slowly we are changing the narrative, the sad narrative of doom and gloom on mental health.
I think depression is a result of mental instability. That's why I chose a training that mainly encompasses mental health. I am liking the training. Actually, I'm loving the training because I've met so many people. The probation officers are lovely. The training courses are what I really want to also curb some issues that I'm also battling with personally.
The Grand Duke of York, you jump on your hands. The Grand Duke of York.
I'm looking forward to extending and scaling up this model from Nakuru to every single county in this country. And I'm hoping that in the next 5 years or so, we should have a PDO-run office in every county headquarters in Kenya.
I would say I haven't met any organization in the country that is really focused and interested in the goodwill of the people than the PDO Kenya.
Thank you a lot to PDO. This is one training of a kind, and you realize that in Nakuru, PDO is one organization that is unique in how they offer their services dealing with mental health. It's an area that most of us are afraid, are shy of.
Thank you, PDO Kenya, for inviting me for this very impactful training. And I know because of this opportunity, I'll be able to create more impact and change lives, especially for the vulnerable girls. And together we'll live happier lives, much healthier lives.
So I'm so very grateful kwa PDO for that training. Nashukuru sana na waendelee kutrain watu wengi ndio kila community ijue mambo ya mental illness.
Yes, I think it's a very important work PDO is doing because there are so many people who need some support, and it's important.
So I really thanks to this training center that they made me this much able, so I can be going to help other people as well outside in my community as well.
I'm looking forward to more trainings from Iregi, the PDO team.
Whatever we are going through, what we are facing, are things that can be demystified. They are things that can be challenged. Through therapies, we can heal. Through reaching to people, we can save the community. Through coming closer to individuals who are suffering mentally, we can help them so much.
I'm very excited about the number of people who've joined this course and who are with us in this course. And I'm sure that 10 years down the line, 5-10 years down the line, our impact will have touched the millions of Kenyans who are out there without help.